really what I am is a person who is a cancer survivor myself, who has been in the past the caregiver to mother-in-law and father-in-law and father who all had cancer. I am most recently a person that was hit by an automobile crossing university, and for the last 7 months have been struggling with many, many issues, and have journeyed through the advocacy, self-advocacy experience that I think many of you are having, and I'll share a little bit of my thoughts with you. I think I was given 5 minutes. I could probably talk for 3 hours. As one of the co-directors of ELLICSR, just to tell you why we started ELLICSR, it was written for a CFI grant, which is the Canadian Foundation for Innovation. And basically we had this really novel idea that we want to create a survivorship center and program. And we thought, well, isn't the best way to learn about how to support and work with survivors and develop like an empowering environment is to learn with and from survivors. And you know, it doesn't sound so novel to me, but it certainly sounded novel to the Canadian government. So the idea was that this is the Centre for Health, Wellness, and Cancer Survivorship, and really it is a collaborative space. It is a place to engage and work with survivors, their families, caregivers, cancer patients who are still undergoing treatment at any stage of the cancer journey, and really to find a way to engage, to learn, and to share together. Like I said, myself, I am a cancer survivor. My caregiver husband is sitting over in the corner. Say hi, Jerry. And that's Jerry. And I have to say, my journey would not be the same had I not had such a great caregiver. So, you know, he nursed me through a cancer journey. He nursed me through a knee replacement a couple of years ago. And he now most recently going through this car accident, and for those of you that know me know that there have been many episodes, from broken bones to problems with nerve damage to being rushed by ambulance to a hospital with something called pancreatic duodenal aneurysms, which apparently almost killed me. And so I've had to have a great caregiver. He wasn't the best advocate, I have to say. Sorry, Jerry. He really didn't, that was not his skill set. So from my bed and through all that, my nature is advocacy. That's why I'm here, and that's why I'm in this leadership position, I guess. And I did have to advocate a lot for my own care on the spot, and was very surprised and happy to learn that the system listened to me. So I knew myself best. I knew what I needed. I knew what kind of things I needed for my care. I knew what specialists should be called because I have lots of comorbidities and issues. And they were most, luckily for me, they were most receptive to listen and to partner with me and to see me as a collaborator. In fact, at one point, it got to the stage where I needed an external person who knew my case best to come in to another hospital, and they got that person permissions to come in and advise, as well as to, if necessary, operate. So I thought that that was really going above and beyond your typical kind of healthcare scenario. But I had to do it myself. When a few days ago I said to my husband, you know, honey, what was the name of this doctor and what was the name of that doctor, and I'm trying to organize my follow-up, and he sort of didn't remember. And I said, next time you need a pen and a paper, because he's great at the caregiving, needs to brush up on the advocacy, and sometimes we just can't do it ourselves. So this, sorry? He really does have a halo. I mean, there was a point where I could not stand up, I could not walk to the shower, I could not, and I didn't want the caregiver from the CCAC. I wanted my husband to help me. And he was wrapping casts, and he was wheeling me to the shower and getting me into the, you know, on the seat and getting me out. And I think he hurt his back. And I just say, you know, you need to understand what your circle of care is and who can help you. And, you know, so advocacy and engagement happens on many levels. It happens on the very personal level when you're in the hospital and you're in your survivorship mode and you're going through your journey. But it also happens when you can take a step back and you say, you know, what can I do to make things better? So this experience that I had about people really listening to me and hearing me was wonderful. I'd like to be able to share that here and look at how can we get our healthcare providers to really listen and engage and respond in a way that's creative and responsive to what the patient's real needs are. Then you're going to hear from Jill, and you're going to hear about these opportunities to really change the system.